Yes, it is. Thank you very much.
All right. So, once again, good evening, colleagues, and thank you for joining. Thank you also to the organizers, and particularly excited to have this opportunity again to be able to share one or two things concerning the series of advancing laboratory quality management systems for better patient outcomes. And today, as it has been discussed, has been mentioned earlier, we'll look at the role of leadership, governance, and documentation, how all of these help to shape the effectiveness of the laboratory QMS in our various laboratories. So for the outline, I'll give a little bit of preamble, especially in the area of what leadership and governance is all about. We look at it with a global perspective and also narrow it down to how it's expected to happen and how it's expected to help, strengthen the implementation of quality management system in our laboratories. Of course, as we go on, we'll be having some terms and definitions just for all of us to be on the same page concerning what leadership is all about, what governance is all about. Then we'll look at the concept of strengthening the lab leadership. What are the things that will help us to achieve that? Then the other part will be, we'll look at documentation of quality management system. So when we say we're implementing quality management system, for example, after it has been established, according to ISO, it has to be documented. How do we go about the documentation? These are some of the things that we'll be talking about. And we can't talk about documentation without talking about the term itself, QMS documents. What are QMS documents? Which level of QMS documents are we expected to have in our various laboratories? Then we'll also talk about, since we are going to be talking about QMS documents, we will also look at strategies for document control to ensure adherence to quality standards. So it's a requirement of ISO. So we'll look at all of this, and then we'll see how all of these three help us, to have an effective quality management system. So before we move on, as is the practice, we'll be having some poll questions. Can I ask that the poll questions be launched, please? Okay, so we have question one, poll question one, talking about laboratory leadership. It says it should be based on the following, except. So please look at this so that to help us understand and appreciate this better when we are going to the presentation. And then the number two talks about document control features. So what are the elements of document control features? The third one talks about records or the necessary documentation required for accreditation assessment. Oh, so sorry you submitted, but I'm wondering how you were able to submit without seeing the other one actually. But it's a poll. I don't think you can be able to, because the poll will not appear again the second time. I'm not so sure it will appear the second time. So let's say if you have the submission, you may want to inform so that maybe we'll know when to continue.
I think you can continue now.
All right, thank
Time
you.
has just gone.
Okay, so those are the questions that we have for the poll. So as a matter of preamble, I want to start with the following leadership quotes, by some of our great African leaders. The first one is from Zeke, and he said, leadership is not about the position one holds, but it's about the positive impacts that one has on others. So please, this will help us to look at leadership in the lab later. So I want us to keep this in mind, what this great mind has talked about concerning leadership. Then there's this former president of Kenya, Mwai Kibaki, that said leadership is a privilege to better the lives of others. It is not an opportunity to satisfy personal greed. This will also help us to appreciate the kind of persons we need in leadership position, even in our lab. And when you have the opportunity, that you should know it is a privilege to better the life of others. And when we talk about this in the lab, we are not only looking at your internal customers or internal clients, which is the staff, the other staff members, but we are looking at the primary customer that the lab is set out to serve, which are the patients. So if it's a lab, then we say you are serving the patient primarily, and then you are also serving the referring clinicians. So then lastly, from John Maxwell, he says leadership is taking responsibility while others are making excuses. Leadership is taking responsibility while others are making excuses. So this will set the tone for us in terms of understanding what leadership should be all about. Then still defining leadership. I got this from an article online, and this has to do with leadership in the lab. And this author says it requires interaction with other frontline healthcare providers. So that is talking about teamwork towards the management, maintenance, and development of clinical lab services to meet needs. I've already talked about the needs you are meeting as laboratorian, which is the patient that we are running their samples. So everything that you do as a leader will be to interact with other colleagues towards the management, towards the maintenance and development of clinical lab services so that you can meet their needs. And we are going to see what the need is to improve patient outcome. And that is what the series is all about, advancing lab QMS for better patient outcomes. That is not where we are supposed to be, but that we are always moving forward. We are always setting another record for ourselves as a laboratory. So also it says again, lab leadership requires effective interactions with individuals, within the lab, also with suppliers, with manufacturers, higher administration, and those that are relying on the services that we are providing. So you are serving both your internal customers, you are also serving people outside, suppliers, manufacturers, even upper management. So I took this leadership definition or the attributes of leadership, what is expected concerning leadership from this training curriculum by APHL, Foundations of Laboratory Leadership and Management. So it says that for leadership, it is expected that you create and innovate, things that are not there before and things that are there but needs a kind of innovation. So leadership establishes direction and defines the future. Establishes direction because it is leadership that has a vision that aligns with the organization mandate. And it helps to align and inspire other people. So I said something about, they have access to vision and mission of the organization. So you align every other person into that vision and you inspire other people as you do so. So leadership is not so difficult. It's something that can be learned, and it has to be learned actually. So people say, I mean, there are school of thought that say, oh, they are born leaders, great leaders. But if you are even born leader, but you do not develop yourself, then you cannot say that you have effective leadership. And of course, leadership is effective or successful leadership is crucial to success. So I also want to look at these terms and definitions from a status report on lab leadership in Africa. And that is as documented by African Society for Laboratory Medicine. So they published these reports, I think sometimes this year. And here they looked at what does National Laboratory Directorate, NLD, means. And it's here it's saying it refers to the entity in charge of lab networks at the national level. So this means the body or the entity that is responsible for the administration of laboratory services at national level. So it's not limited to laboratory services for diagnostics. There are other laboratory services for surveillance and all others. So leadership refers to the cadre and skills of those heading these NLDs. And as I put down, for us in Nigeria to better relate with this definition, we'll look at the Medical Laboratory Services Division, hosted in the Federal Ministry of Health, as the focal person, or the equivalent of National Laboratory Directorate for us here in Nigeria. So that's all about leadership. Let's also take a look at governance. Governance entails the contextual elements outside the NLDs themselves, such as institutional hierarchy, above a given NLD. So we can talk about the system that help us run our laboratories. So this must exist within a Ministry of Health and the technical working groups that help guide and govern laboratory decisions in the country. And know that for us to get it better at our own laboratory level, there has to be like a clear mandate, from the national. So, and we are going to see one of the submission from this status report by ASLM. So, still talking about the terms and definitions, governance is the act or process of overseeing the control and direction of something, such as an organization. I explained this earlier, that has to do with the system that help us to run our lab effectively. Lab governance is a framework that helps medical lab become accountable for continuously improving the quality of their services. So if we do not have a system, we cannot be held accountable. If the framework is not so clear, especially to leaders, then they cannot run the lab effectively. And they cannot be accountable, one, to the employers, in this case, the Ministry of Health, to the facility management, and accountable to the reason we are all in business, which is the patient in this case. So quality initiatives to facilitate clinical governance in the lab include accreditation to an external standard such as ISO 15189. So when we have this, it will help us to determine whether or not we are providing the right services that is required to meet the needs of the client or not. So all of this is to help us understand what governance and leadership, as the case may be, is all about. So ISO 15189 2022 talks about governance. And in clause 5, the whole of clause 5 is dedicated to structural and governance requirements. So when we talk about this we talk about infrastructure, the kind of system that is expected to run. So, and then what are the other sub-clauses under the structural and governance requirements? We talk about the legal entity. We talk about the lab director, the laboratory activities, where every laboratory is expected to document the kind of activities that they do in their laboratory. Also, the structure and authority in each of the lab has to be documented. And of course, you have objectives and policies and risk management. Then let's look at laboratory leadership and governance in Nigeria. And here I take a look at the Nigerian National Medical Laboratory Services Policy. The current version is the version of 2023. And I'm starting with this statement that a functional organizational structure provides stewardship, coordination, and management of laboratory services at all levels. So this is what gives opportunity for a lab to be able to account for all their activities and demonstrate that they are fulfilling the requirements. Based on the information from Nigerian National Medical Lab Services Policy, it says they identify one of the major constraints against the effective contribution of laboratory to healthcare delivery. You know, we are just one of the departments in the hospital. So one of the things that is not helping us to effectively contribute to healthcare delivery is weak governance structure. And this is due to absence of a clear organizational structure and management roles within the Federal Ministry of Health and State Ministry of Health. So for each lab, either a tertiary lab, a state hospital-owned lab, a private lab, to function properly, there has to be something that they are looking at. So the management, the coordination, and supervisory responsibility of lab are undertaken by different units of the Federal Ministry of Health. And currently, like I said earlier on, the Medical Laboratory Services Division in Federal Ministry of Health is the focal point for medical laboratory services in Nigeria. Then it's also worthy to note that for us as a country, and as documented in NNMLSP 2023, the regulatory framework is provided by the two key professions, that's the Medical Lab Science Council of Nigeria, as well as Medical and Dental Council of Nigeria. These councils provide oversight over the activities of their respective members, according to the individual acts that establish the two councils. So how do we strengthen lab leadership and governance? There's an article I also saw online as I was preparing for this, and that was titled Good Governance in Lab Stewardship, a Roadmap for Success. What are their suggestions? And the first thing they identify also, like we have in the policy that I earlier talked about, is that labs often struggle with creating a strong governance structure. And they had a study where 47 survey respondents that talked about, the success of their program highlighted the importance of multidisciplinary teams as a major contributor to success of their stewardship programs. So to meet this objective, the article suggested key elements: governance, interventions, data extraction and monitoring. We are going to see how the data will play a role in helping us in subsequent slides. So this, I think this should be about the last one on leadership and governance. Still talking about the report of ASLM. And here it's saying it identified that the space that the lab leadership occupies currently in Federal Ministry of Health inhibits autonomy, and it gives a kind of scenario where lab is not well represented. They are not close to leadership in terms of hierarchy. So the observed number of levels observed between the lab directorates and Minister of Health. So they need to go through this, through that. And this clearly shows the challenge of accessing top leadership. And that is why people devise means of getting to the top management, even if it is a true political means. So let's look at lab director as the core component of leadership. So I mentioned earlier that clause 5 of ISO 151 in 2022 talks about structural and governance requirements. We have 5.1 that talks about legal entity, 5.2 talk about laboratory director. So the first two elements under laboratory director talks about competence of the lab director and the responsibilities of the lab director. So for the 2012 version of this standard, it actually suggested some key responsibilities of laboratory director. And for labs that we support for accreditation, I simply tell people, though 2022 did not dictate what those roles should be, but in defining and establishing or documenting your quality management system, I strongly encourage people to still look at how the responsibilities were documented in the 2012 version and just use that to prepare what the lab director responsibility should look like. Because in 2022, the instruction is just that the lab shall document, the responsibilities of the lab director. But what is so critical, and I'm going to explain that in the other slide, will be that the lab shall be directed by a person or persons, however named, with the specified qualifications, the specified competence, delegated authority. So it comes from the NLD to say, oh, this is the qualification, this is the competence of somebody that should be the lab director or lab manager, as the case may be. And then it also says that whoever is there must have the authority that is documented, delegated authority. So how do we address this challenge that was identified in the medical lab services policy? That is weak governance structure. How do we address this and change the narrative in a typical laboratory setting? So I have some key considerations. Number one is that we need to know that the medical laboratory workforce comprises of highly skilled and educated laboratory professionals. Interprofessional harmony among these professionals is key in ensuring the lab deliver on the number one goal, which is improved patient outcome. So the professionals will need to work as a team for them to be able to deliver on improved patient outcome. What are the essentials? There has to be a well-formulated policy on human resources. Remember, we talked about having that structure, even right from the National Laboratory Directorate. There has to be an organogram that is showing interrelationship of staff. How do we relate and at what level? There also has to be a job description for each staff with details on key responsibilities. We said the lab will provide stewardship, will be accountable. This will now drill down to individuals that make up the workforce in the lab. So there has to be a clear job description for each staff. You need to know what you are expected to do. What are you going to do? And then when it now comes to performance appraiser and all of that, you should be held accountable for those duties that have been documented. And of course, this duty, the job description, has to be communicated to the staff, to the incumbent of that position. And it's not only things like, you run tests, you will run or you will review results, or you will run IQC. There are other things, especially quality management system functions, responsibilities that are supposed to be defined and attached to incumbent of each of these defined positions. And I put this one in red, that appropriate capacity building program is essential for each cadre of staff, as this is necessary to improve productivity. This training, I'm recommending that it should start with the lab directors or lab managers. So still talking about some key considerations. Leadership should be based on specified qualifications, demonstrated competence, delegated authority, and availability of resources. So if the management has delegated, certain rules, it should be backed up with resources to fulfill that office. And the ability of the leadership to manage all the teams, playing the different roles, is necessary for an effective governance in the lab. To meet the needs of clients, the leadership and governance structure is key. So I talked about there has to be positions in the lab that will help the leadership of the lab director in this case, to achieve effective implementation of quality management system and ensure reliable test results. So these are some recommended positions for effective governance. We need team that will oversee the quality assurance program of that lab. And this QA team will monitor activities such as proficiency testing, will review internal quality control, management review meetings, will coordinate internal audits, will supervise how to select, to track, and monitor quality indicator. And of course, will prepare the lab for accreditation. They will also look at development of essential or required quality management system documents and review of these documents at the appropriate time. So apart from the QA team, you need to have client or stakeholders management that will relate with clients, that will make sure the clients are happy. Some of the things that this team will do will be also to conduct periodically customer satisfaction survey. They will need to look at, getting complaints, resolving the complaints, providing feedback on these complaints. We need a team also that will oversee equipment management. So when I'm saying team, this depends on the lab. It depends on the workforce that you have. So one person may actually take more than one roles. But these are the key things that has to be identified. So we also need a team to monitor the logistics and inventory management, sample management as the pre-examination process, the result management at the post-examination, the biosafety or biorisk management, documentation or administrative function. This will include making sure that personnel files are up to date and that they have all the necessary information about the patients in that particular, in the individual files. So we also need a team to oversee research and innovation. This will help to look at, what are the additional tests that can be done by the lab to improve how we serve our patients and how we serve the community better. They will be the one to suggest, this test is not currently being done here. What can we do to set up this particular test? We have been using a particular method, for a particular assay. What are the other methods that are better, that are more cost effective and also reliable? So they would look at, let's do verification of this new product. They will be saddled with the responsibility of verification. And if they do working with maybe national task team on post-market validation of new kits. So all of these are things that are expected for us to have in the lab. And when all of these, whether given to individuals as roles or your lab is big enough that you are even having teams to handle these positions, this will help the laboratory director, the leadership of the lab, to actually achieve effective implementation of quality management system. So let's look at lab documentation for compliance and productivity. Why do we need to document in the lab? Most of us on this call will remember the case of baby Eniola in Luth some years back. So as I was preparing for this, I tried to search for it, and it's online, hosted by one of the dailies. And this is the way they captured baby Eniola, Luth, and Law. And we remember that if you remember that story or you heard about the story, It is lack of documentation that make that error to go out unnoticed until it became a legal issue. And that also affects some administrative structures. Some people were demoted, I think. Some people probably were sacked, can't remember. But that was an issue of lack of documentation. So when we say documentation, what does it mean? This talks about material that provides official information or evidence that an activity has been carried out or it serves as a record. So in most cases, when you see documentation, especially in this my presentation today, when we are talking about, what are the documentation necessary, you will see them in form of records. So documentation also means material that provides official information. Oh, sorry, it is tautology. And then I try to look at this popular slogan in the lab, and it says that if it's not documented, then it was never done. I tried to trace the origin of this quote, and then I saw this also, that there was an original quote by Second in the saying, if it is not written, it means it never happened. If it is written, it doesn't matter what really happened. So, but in the lab, what do we say? If it is not documented, then it's believed that it was never done. So for us that are auditors, when I go to lab, for audit, for assessment, one of the key things we tell the lab, the auditee, is that, we are coming to check how well we are conforming to the requirements of a particular standard. Say, for example, I'm using ISO 15189, as my audit criteria in that lab. So I want to see how your lab is conforming to the requirements stated in the ISO 15189 standard. And there are things that you have done before we came. Let's say I'm looking at the record of 1 year. I need records to show me that you were able to implement the way the standard expects you to implement quality management system. A quick example would be, we monitor the temperature of the fridge, of the freezers, the room temperature. We monitor it. And then I won't say you are not doing it, but I need to see the record that this was actually done as at when due. And if there is any issue that you took appropriate action. So documentation of quality management system, as we say, is an ISO 15189 requirement. So if you look at clause 8.2, it is management system documentation. It used to be clause 4.2 in the 2012 version of the standard. So under the general, it says the lab management shall establish, document, and maintain objectives and policies for the fulfillment of the purposes of the standard, and shall ensure that the objectives and policies are acknowledged and implemented at all levels of the laboratory organization. At all levels, that means everybody that has a role to play in the lab, including if you have cleaners, if you have drivers, everybody that have to do something in the lab, they will need to make this available at all levels. Now, please take note that the management system documents can, but are not required to be contained in a quality manual. I decided to put this note also to bring our attention. Most of us that are implementing 2022 will remember, if you have implemented 2012, you remember that 2012 quality manual was a requirement of the standard. But in 2022, I cannot go to a lab and raise a non-conformity that you do not have a quality manual because it is no longer a requirement. However, it is expected that all the policies that are required in the standard, they are also maintained. So for us as a country, I ask the question, so what is the better place to maintain your policies if they are not going to be housed in a quality manual? And we've actually made recommendation that it is not going to be a non-conformity for you to still keep your quality manual because it helps you to handle those policies and for you to implement QMS better. And we recommend to labs that please keep your quality manual. I've talked about the access of personnel, to all the documentation, the quality manual, the policies, the processes, the SOPs. This has to be made available and accessible to the personnel at all levels. So when we talk about documents, I said we are going to take a look at what documents really are. So what should the laboratory document? For now, we look at the classification from the level of policies, followed by processes, procedures. Then we have forms, job aids, work instructions. And these are definitions of what each of these level of document is all about. For policies, it talks about what to do. It's a written statement of the overall intention. And this is formulated by upper management. While processes shows how the interrelated or interacting activities are arranged together in a sequential order to transform inputs into outputs. While the SOPs is what is common, is a step-by-step instructions for performing a single activity. And for job 8 is a shortened version of SOPs and is also called benchtop references. So we are still looking at what are QMS documents as part of our documentation for quality management system. So documents are the communicators of the quality management system. And this is essential because verbal instructions often are not heard, can be misunderstood, can be quickly forgotten or difficult to follow, and can be easily denied. He said, no, Mr. Lab Director, that's not what you said I should do. So documents are a reflection of the laboratory's organization and its quality management. So a good rule to follow is do what you wrote and write what you are doing. The way I like to explain this is that if you have written a procedure, SOP, for example, then follow your SOP because that is what you have written down. So do it the way you have written it. And then the other part that says write what you are doing. The first part will say that if you do not have a SOP, please write SOP to tell us what you are doing. And if your SOP needs review or revision, you need to now write what you are doing at the moment. So some elements of good documents, it should be clear, it should be user-friendly, explicit in nature, there should be no ambiguity, it should be accurate, and it should be up to date. So we can't talk about documents without also talking about records. So documents and records, the document that we have said earlier, communicate information through policy, processes, and procedures. It needs review. Records capture information on worksheets. Records are documentation or evidences of implementation of quality management system, evidences of all activities performed by the lab. So when I say, oh, show me something, or have you done something, what I'm asking is, show me the record of the activity that has been carried out by the laboratory. So Records are created as evidence of implementation of quality or technical activities in the lab. When data is captured on a document, it turns into a record. So let's say I have a newly developed equipment maintenance form for XYZ analyzer. And I say, oh, in the morning, I'll perform the following steps as part of my maintenance procedure. Oh, start up, calibrate, check the probe, clean the probe. And I'm expected that as I've performed each of these activities, I will go to the appropriate portion in my template, the equipment maintenance sheet of form, and I'm going to tick it that I've carried out this activity. Immediately I tick or make record on that this activity has been captured, that document is no longer a document that has been transformed to record because it has captured information on it. So records are created concurrently with the implementation of tasks in the lab. So we've talked about documents. Let's look at how to control our documents to ensure adherence to quality standards. So when we say quality, I mean document control. The goal of document control is to ensure that only the current version of the document is always available for use. So in essence, we control our documents to prevent unintended use of any obsolete document. So it means that the versions of document that are available and accessible to personnel are those that are the current versions. So document control is a requirement of quality standards. And that is why when you talk about quality management system, people will need to ask you, you are implementing QMS based on which standard? So you see, I keep making reference to ISO 15189 because that gives, direction to know what I'm conforming to. I'm implementing QMS based on this standard. So it tells me, what are the requirements concerning a particular activity. So document control is a requirement, one of the requirements of ISO 15189. And we see that in clause 8.3. In 2012, it used to be clause 4.3, and then it is called document control. So you see, control of management system documents. The first one is 8.3.1. 8.3.2 talks about the control. So the 8.3.1 here gives information about what document really is all about, or what can be categorized as documents. We've given an example earlier on that this could mean policy statements, SOPs, job aid flow charts, biological reference intervals and their origins, charts, posters, notices, and all other things. All of these can be either generated from internal. As a lab, we have developed these documents, but it could also mean documents of external origin. Both internal and external documents must be controlled. So the lab will need to define what should be the document control feature for each of these level of documents. So what are the things that the standard wants us to focus on concerning the control of documents? It has to do with unique identification. That is the ID of the SOP number, policy number, job aid number. And I have some slide that will give an example of what this unique identification means. So documents are approved. That's the second thing, are approved for adequacy before it is issued out. And this approval is done by authorized personnel who have, one, the expertise and competence. So it is not just about, oh, this is the chief in this lab or something. It has to do with the person that have the expertise and competence to determine that this SOP is adequate for this particular activity. Documents are periodically reviewed. It is never done. I remember those days when we started implementation. Before we stopped or before our system become a bit stable, we have quality manual then up to maybe 6th version or 7th version. Because each time we do audit, we just see, oh, this part was not properly captured. And then once there's revision, then you have to, especially major revision that affected, a lot of sections, then you need to go to another version. So documents are periodically reviewed to be sure that they are still relevant to what they are being used for. So relevant versions are made available at point of use. Changes and the current revision status are identified. Documents are protected from unauthorized changes or deletion or removal. So a good part here, if you are maintaining your documents in an electronic format, I encourage people to have their documents in PDF format that is logged, that is non-editable, meaning you can provide read-only access. And that is to make sure that the way it is at the point of approval is the way that it is, when people keep reading. If you maintain it as MS2, for example, if somebody is going through it, there's a possibility of deletion or addition, unintentionally, and then you realize that, oh, this is no longer representing the document. And then at least one paper or electronic copy of each obsolete control document is retained for a specified time period or in accordance with applicable specified requirements. So let's look at this in pictures. So for this, my documents, I'm putting the title of the document is Lab Quality Manual, the section where it is being used. If it is SOP for full blood counts, it will be there. The document ID, this is the unique identification. So they will have it as this. All of these have what it means. So if you need to have this, you need to have another SOP that explains the identification, the indexing, the coding of your document. What does MA, for example, means? What does QM mean? What does V4 means? Some will just simply put SOP-012. Whatever means you want to identify it, make sure that it is documented and everybody is familiar with that pattern of numbering, the numbering system. And then you put the version. What version of the document is this? The effective date, and that it supersedes this. So you have this. The SOP is prepared by, reviewed by, and approved by, including the signature and date of the authorized persons. So another part that talks about the review of document or revision is this part that will talk about the version number, the review or revision date, the next day that this is due for review, and then the reason for amendments, especially for revision. For review, you simply sign off on it, that this is just maybe an annual review, and then nothing has changed in this document. You simply sign and acknowledge that this has been reviewed, because it's a requirement that you review your documents. Then, what I encourage people to do is to leave this side as blank so that you can manually write that, oh, I've reviewed these documents. This is the date of review. This is the next review date. And then you sign off. So you don't have to print this each time you want to acknowledge that there's a kind of annual review of the document. And then we have a national guideline on documents and record retention. Remember, one of the slides previously talked about retaining obsolete documents according to applicable laws. So this national guideline is hosted on Medical Lab Science Council of Nigeria website. So it can provide guidance on how long you can retain your records. So we're still talking about lab documentation for compliance and productivity. And the reason for this, there is this Chinese proverb that says the palest ink is better than the best memory. This is telling us why it's important, or why should we worry about documentation. And for me, as an assessor, we have this common slogan that says, in God we trust, all others, we audit them. So if I come to your lab and you say, Dr. Emmanuel, yes, we did this. We did our IQC, we review it. I'll be nodding my head and I'll be waiting for you to provide the evidence of that implementation. And if you are unable to provide that, I will simply note that at the time of audit, IQC was not performed and there is no record to show that they are being reviewed. So it's not about swearing the name of God that, oh, we did it. Once it is not documented, there is no way I can believe you. So we comply with documentation policy. One, to meet the requirements of quality standards, to ensure consistency and uniformity. Variation is the number one enemy of quality. And then when we have good documentation, we are always a friend of assessors when they come around. This slide, I decided to put it to showcase when a lab is preparing for accreditation, you are going to be visited maybe for initial assessments by accreditation body. What are the essential or the common documentation that is required for that purpose? Of course, we've been talking about quality management system documents, policies, procedures, processes, as the case may be. You need to have the complete required document. So if you look at the SOP, the ISO standard, where SOPs are required, it is there that the lab shall have a procedure for this. In 2012, you see a lot of the lab shall have a documented procedure. But in 2022, you see more processes and less of procedures. But we still encourage people, let your SOP be there because it's actually help you to carry out the activity more effectively. Of course, you need to have personnel folders, having the records of the personnel, competency records, training records, vaccination records, as the case may be. Minimum as required by the standard, but you can add more, just to keep that. You, of course, need the records of your PT. PT is one of the key elements. Without PT or interlab comparison, you cannot think about accreditation. Also, records of internal quality control, minutes of meeting, management review meetings, action points from those meetings, not just the narratives. What are the main meat from the meetings? What are the action points? And evidence that you are tracking the completion of each of the action points. Non-conformities and corrective actions, including root cause analysis, records of internal audits, maintenance records, verification records, customer survey, complaints, and other quality indicators. All of these are required at minimum, for accreditation assessment. So I've explained this before, but it's just a peep into the past. And this is taken from the 2012 version. And I'm bringing it up because I love the way it was actually structured in the 2012 version of the standard. So it says the documentation. So for 2012, he gave the lab like a list of what is expected at minimum. So that there has to be a statement of quality policy and quality objectives. Of course, I've talked about the quality manual, the SOPs and records required, documents and record copies of applicable regulations, including the ISO 15189 standard itself, has to be retained as part of the documentation requirements. And of course, it has to be controlled properly. So when we have this documentation in place, I gave an example earlier on. How do we review our quality management system objectives? So in clause 5.5 of the current version of the standard, it says that the lab management shall establish, excuse me, I'm trying to, oh, somebody is saying audio is lost. Please, can someone else confirm if you can hear me?
Yes, I can hear you, sir.
We are good over here. The audio is clear. I think the person needs to check their settings.
All right. So, Dom Izundu, please check your audio. Thank you so much. All right. So, now, for quality objectives that are required in the lab, I have the next slide that talks about, that give an example of what it looks like. But what exactly do we mean when we say that, implementation of quality management system in this lab is effective? Like I said earlier on, for auditors and assessors, in God we trust, others we audit them, we will need evidence that QMS implementation is effective in your lab. So what are the evidence that I want to see? I want to see measurable objectives that is consistent with policies. I want to see that you have established quality indicators which are actually used, to drive the implementation, the maintenance of the objectives and policies. So let's take a look at what that is all about. And here I'm giving you the quality objective I'm planning for Dr. Adewale Ojo Lab for 2025. Though this lab never exists, at least yet. So, but this is what quality objective documentation looks like. For people that have not been able to do this, we say it has to be measurable. What we mean by measurable is that you need to attach a quality indicator and you need to set a benchmark. So let's take a look at the first one. He said, my number one objective for Dr. Adewale Ojo Lab is to provide quality laboratory services that will meet customer satisfaction of greater than 75% annually. What I will need to do or use as a quality indicator to help me monitor this objective will be to do customer satisfaction survey. And I will draw my questionnaire in a way that I can allow the people using my services to rate my lab. And then I will see whether I'm meeting the benchmark that I've set or not. Number two objective is to produce greater than 85% of all lab results within the laboratory turnaround time. So what I do, especially what I recommend, especially for multidisciplinary labs, this could be so overwhelming. If you are going to do TAT, for PCV, for hemoglobin, for monocytes, for full blood counts, all of these assays have different turnaround time. Some have maybe 2 days in microbiology, 48 hours. So what we do is to select assays that we can call pointer assays in each of the sections of the lab. And those are the ones that you monitor. So you monitor that, let's say in a month, you want to see how many of my results were released within the set turnaround time. So if I say my glucose result, for example, will be done and released within 6 hours, I will now count within that period how many glucose results did I release That will be my denominator. I will count again. How many of these glucose results were released within 6 hours? Not exceeding 6 hours. And that will be my numerator. With that, I can calculate the percentage of glucose results that were released within acceptable turnaround time. And for you to be able to do this, it means that you must have records. Records of when results are ready. The time you receive the sample, the time the result is ready, you need to have all of that. Then EQA, PT is another objective. Service interruption is another one. And of course, achieving or attaining accreditation is another one. Still talking about what is the evidence of QMS, effective QMS implementation. The structure here on the right, and this credit is to Anamorphy. Anamorphy is a trainer, is a clinical laboratory scientist based in the US. She taught us QMS those days, and she designed some of these modules. And I got this particular one from the SLAMTA 3 TOT curriculum. So this particular cycle is what we call the bonnet model of QMS implementation. And this is looking at it at system level. So it categorizes everything that has to be done under management responsibility, resource management, product realization, and then the last one is under measurement, analysis, and improvement. So for you to be able to say that my QMS implementation is effective, you must put quality indicator in place that will help you to measure the effectiveness of your QMS implementation. And that's an example of what I gave earlier on in those examples of the quality objectives. Then when your result is ready, you analyze it and check how many of them are meeting with your benchmarks. Those ones that are not meeting the benchmarks, then you need to initiate improvement action. So the lab must measure and analyze the QMS performance and then act on its findings to continually improve the system. So you need to act on your findings. But before you can act, you need to check. There is this slide that will talk about that. So what are some examples of continual improvement tools? I've talked about quality indicators, the non-conformities, internal and external audits, management review. All of these are things that help us drive continual improvement. So improvement has to be cyclic, it has to be continual. You need to keep adjusting the benchmark. Even if you are there, you need to keep checking that you are not really dropping the ball. When we started the SLAMTA program, sometimes in 2009, as a country, we have a lot of labs that took it as, oh, it's a new concept. We're working, providing the necessary activity, the documentation. And then after the first assessment, some people were on the rating then was like, oh, whether it's 1 star, 2 star, people reach as high as 3 star, 4 star. And then for some labs, within that same cycle, let's say within 18 months or thereabout, some labs drop from the 3-star rating or 4-star rating to like 1 star, maybe some to 0, because of lack of continuity. And this is not just about QMS alone. For us as a country, we can have a good structure set up, but the main thing that we are lacking currently is the maintenance culture. I finished an audit in a lab today, and then I looked at the structure that was built years back. And I saw so many things. Some things were even brought, installed, but were never used. Some were just dropped there, never installed. I saw an incinerator, in the compound that they are saying, oh, it was donated, but now the facility or somebody could not provide maybe resources to install that and use it. So maintenance culture is actually a systemic problem for us as a country, and it's also affecting implementation of quality management system. So these funnels explains how we achieve continual improvement. And it's talking about what are those elements, what are those indicators that help us to determine whether we are doing well as a lab or not. So if you look at up here, you see clause 8.8 of ISO 15189-2022 talks about audits, quality indicators, and external audits. Here talks about information from external people, that's complaints. Also your IQC, your external QA. All of these are what are monitored to know whether we are doing well or not. And if there is any violation reported from here, we are simply going to generate what we call a non-conformity. So clause 7.5 of the current version of the standard talks about non-conforming works. Non-conformities are raised, they are investigated, appropriate corrective action is taken, and then this will lead to continual improvement. On the other side, the current version of the standard also talks about there are things that are not yet non-conformities, but they are what you call risk assessment, meaning something has not really gone wrong, no wrong result has been released, but we are just studying the trend of the way things are going. And we realize that, oh, this thing might go out of hand if actions are not taken. So you also get feedback from customers, suggestions, and all of this also feed into another funnel of opportunities for improvement. You do your risk assessment. When all of these are done, it is targeted towards improvement. So if you look at this whole structure here, we are looking at, from all of this, we are looking at measurements and analysis, use of quality indicator. And then we look at, from this side, what we are trying to achieve here will be improvement. So when all of these are done, corrective action are taken, or we implement opportunity for improvement, what we are expected to have, of course, will be that the lab is actually improving. So all of these are things that help us when we talk about, oh, we want to achieve improvement in the lab. So we have continual improvement based on that. So one of the checklists that's popularly used is the WHO Afro Slipper checklist. And section 2.5 talks about routine review of quality and technical records. So this is a checklist that help you, to monitor the effectiveness of quality management system. By the time you look at previous review, report from personnel, review of environmental logs, it will help you to know whether you are conforming to the requirements of the standard or not. So quality improvement simply means acting on your findings. And according to Philip Crosby, it isn't what you find, it is what you do about what you find. And that's according to Philip Crosby. Philip Crosby is one of the quality gurus that had some theories about the implementation or the establishment of quality management system, even beyond the healthcare or laboratory setting. So to achieve improvement across all the areas of lab operation, I recommend that you set appropriate indicators. You monitor these indicators that you have selected and track them over time. Review data from these indicators, and then you act on the findings. So, like I said, improvement means acting on your findings. So, analysis without action is meaningless. Meaning you just come, audit a lab, or you do your indicator and you see it below benchmark and you submit your report, without taking action, it is a fruitless effort. And if you flip the coin, action without analysis is dangerous. So you don't just take action without doing an analysis, of your findings. These are my key messages as I round up. To effectively meet clients' needs, the leadership and governance structure is key. I also want to state that documents are essential for assuring accuracy and consistency in the lab, and also to state that document control prevents unintended use of any obsolete document. And I'll conclude with this leadership quote by Dr. David Oyedepo, the Chancellor of Covenant University. And he said that leadership is not occupying a seat, it is accomplishing a feat. It is not occupying a position, it is making outstanding contributions. It is not an appointment, but an attainment. So, in the lab, we say if it is not written, it was never done. And I want to thank you so much for your attention. And I will now allow your contributions, your questions before we round up. Thank you so much.